We're going to be presenting today the issues of body compositions, BIA tests, which is bioimpedance assessments. We're going to find out what it is to actually give you control of your particular body physiology. Now, as a functional medicine provider, my name is Dr. Alex Jimenez. I'm going to be discussing the issues of how to first begin the process of being assessed. We're going to take this assessment process and we're going to go further, not only in explaining exactly what it is, but we're going to try to give you an insight as to how physicians around the world that are into a real deep understanding of the human physiology really put forward some information for you to be able to calculate. It's no longer good enough to kind of figure out what's your body made of by just how tight your pants are, or, I just don't feel as swole today, I feel good. Or just looking at a weight number in our body. We realize the body has a lot of different compositions, and for that, we have a body composition assessment. As you can see there, we have the in-body result sheets. But first, I have to introduce my peoples. We have Kenna Vaughn we have their Landry, I think, in the lower right-hand corner. So she's special, and we're going to actually bring a baby to our podcast. We're the only ones that bring babies to our podcast, right? And we have at center there, we have our master nutritionist, Paola Rodriguez Arciniega, who is a specialist in a lot of health nutrition issues. And we're going to be discussing particularly today the health body. Now, I'm going to hit it home by, or at least start the process by explaining what I do. I'm a functional medicine practitioner. I function in biomechanics. I'm a chiropractor by trade. But what I also do is we work with a lot of athletes and a lot of fitness issues. In that process, as a STEM, we've also been evaluating a lot of neuromuscular disorders. At the basis of evaluating our disorders, we have really been part of the new movement, which is inflammology and inflammation at the basic core, whether it's an autoimmune disorder like rheumatoid, or if it's a disorder such as an inflammatory like a systemic lupus, or any sort of, let's say, thyroiditis issues. Autoimmunity means that the body just doesn't like itself for some reason. It just kind of starts chewing on itself, causing a lot of issues. So what we're going to be discussing is, before we actually determine whether a patient is a good candidate for us, we run a real detailed history to evaluate how the biomechanical system is related to these inflammatory states. So we can't just look at someone and say, hey, you know what, you look like you're just a little bit overweight, maybe swole a little bit, and let's start there. No, we actually have to get real true figures. So when we start, we do a very highly researched type of procedure, which we use the in-body system to evaluate our bodies. Now, today we're going to be discussing certain topics. We're going to be discussing body composition, fat, water analysis, obese risk, and we're going to be just kind of going over a little bit about the details as to what we're going to be discussing. So I got a PowerPoint here. We've also going to be handing this particular presentation over to Kenna as well. So I'm going to start with Kenna, and we're going to start with pretty much understanding exactly from a health coach point of view, what is it she sees, and I'm going to add my point of views as she can. As time goes on, I'll interject and I'll take over, and let's see how our little Landry likes the fact that mommy's chit-chatting on the system there. So we're a pretty dynamic team. So I'm going to go ahead and if you want, I'm going to disconnect my screen. Can you share your screen, Kenna?
Yes.
Okay, I'll wait for you. Let me just kind of give you as a background history. When we do an in-body assessment, we're going to be assessing body composition. We're going to be doing fat analysis. We're going to be doing obese analysis. We're going to be discussing particularly a lot today with kind of visceral body fats. We're going to be discussing issues with the areas of whole body phase angles. We're going to be discussing those particular issues, and we're going to be discussing how a historical background on a particular individual in a particular care plan can be assessed and evaluated. Now, once we go through these things, we're going to be able to give you an insight as to how we begin the process of assessing. And on top of it, you're going to be able to see how Paola is going to be able to do updates and edits to your diet as it masters through. Okay, so she's going to present that little component right there, and she's going to take us on a little tour of what we do when we evaluate a person with at least the in-body body composition assessment. Take it away, Kenna.
All right, so as you can see, there's different chapters that this is broken into. Chapter 1 is mainly focused on how your total body weight breaks down, such as the intracellular water, extracellular water, dry lean mass, and body fat mass. So when we're looking at the water components, this is super great and gives us a lot of information in regards to swelling and inflammation and edema that any patients might have. So we want to definitely take these numbers into consideration, and a little bit further down, I'll show you exactly how it's broken down in more detail. This dry lean mass is going to be how much of your body is lean muscle. This factor is super important because we want our muscle mass to be higher than our fat mass. And this is also what's going to break down and give us our basal metabolic rate, which is how many calories we burn just laying on the couch. It's how much our muscles are actually working and fueling, how much energy we need to provide them with daily. And the last one right there you see is body fat mass, which is how much of your body is fat. This is also super important if we look over on this factor in visceral fat. So that body fat mass also has to do with this. Visceral fat is the amount of fat that's surrounding the organs. The more of it there is, the more complications that we will have and the higher our risk is for disease. So we want to make sure that that is in check. All of these come into play if you look over in this range as well. And you can see again right here, if we had a patient who was overweight and suffering from edema, we would see in this body fat mass, this negative sign and pounds. Their pounds, it would show a number like 5, 10, 15, however much is calculated to see how much weight they need to lose in order to get their visceral fat into a healthy area. This is where we work with myself as well as Anna to really get that diet under control, the exercise, lifestyle changes that we can start implementing that same day. They're not going to be drastic at first because everything we do, we want to make sure that it is attainable for our patients, that it's something that they're capable of, so that health becomes easy for them. It starts their long journey. They don't have to jump right to the finish line. We want them to be successful. And so by using these detailed reports, we can create those personalized plans just for them in order to help their success rates skyrocket through the roof versus other clinics or other places that might just do like a fad diet. We really work with you, and that's why these numbers are so important.
Let me kind of interject there. One of the things that we've learned over the years is that we start with a thesis. A thesis is that an idea, a plan that we want to ultimately prove. In our situation, our patient, each individual patient is a thesis. We have to assess not only the body mass, but the type of diets that we have to work with that individual. Now, we use a little bit more sophisticated equipment to determine VO2 max, or these are more complex things. We'll discuss that in a few moments. But what we want to do is we want to be able to really assess the actual dynamics for that individual. Now, we can start out with plan A. At that point, I promise you, by the time we hit plan C, we have already changed direction just because we have to see exactly what's going on. So with the help of Anna, Paola, who's our nutritionist, and if you don't mind, Anna, can you tell a little bit about the things that you look for in this body composition to come up with changes in the dietary plan and the protocols that you put into effect, whether it's an increase in protein or an increase more in carbohydrates? Because we also, at this present time, we also do keto stick assessment. We want to find out the metabolism of the fat. So we also do not only blood pressure and blood glucose assessments, but there's a real tie-in. Even though this may sometimes be complex, you have a team here. So I want to introduce you to Anna, and take it away, Anna. Tell us how you look at this as you adapt and change dietary requirements.
Well, something that I have to start right off the bat with the patient is that we have to talk about the weight. Weight is like the most important thing for them. So I have to actually tell them like, okay, your weight is separated by many other components. So we have to go first to, okay, here's your weight. Here is how your weight and your height affect your BMI, which is actually a body mass index, and it's it is actually how your body kilograms, your body weight in kilograms is distributed in your height in meters. So I like to go through that. If it's a little bit on the off side of the scale, by this means that it's actually a little bit higher than 25. I like to go and really explain the patient how the body fat mass and how the skeletal muscle mass is playing their role within the weight and the BMI. Because sometimes we think, okay, the BMI in this patient is a lot. It's over 25, then it must mean that he or she is overweight, and that's not true. We have to see what are their skeletal muscle mass and how much is the body fat mass, as Kenna said. So that is one of the things that is like very important for the patients to know, how the skeletal or the muscle mass will play its main role and how the fat mass will play another role in this composition story. So that is like the first thing that I explain. And right after that, I like to integrate that piece of knowledge with the fact that most of the times we have to translate it into risk, either cardiovascular risk or maybe dyslipidemia. So we have to take that into account. Why is our patient coming to us? Why is he going through this body composition assessment? So that is like very important for me to explain to my patients. Another thing, very important part, is the visceral fat area that actually gives us like a more detailed information about the risk of having either metabolic disease or even how the fat distribution is going on in their body. If they have like a pear shape kind of body distribution, or if they have like a apple distribution kind of body, and that would actually let us know a little bit more about the risk of metabolic diseases. So
let me ask you, in this particular dynamics, when we look at the information that we have here, and Kenna, just leave that there. We're going to use your monitor. We're going to ask a question specifically about the visceral body fat. When you say the apple-shaped individual, that individual many times has a lot of visceral body fat. What are the things that you look for specifically when you look at this? Do you look at the type of kind of adiposity type of body prior to you coming up with a nutritional plan? I'd like for them to know what kind of things you opted food wise.
But first of all, we have to know if our patient is either a male or a female, because body distribution is like a big part of like the gender. So most of the times we prefer that the woman would have like a peer distribution and the men to have like, well, not precisely like an apple distribution, more like a Dorito, but in the right way. So that is like first thing that we have to say, like what gender is our patient. So yes, that is like very important. But secondly, you were asking about foods. What kind of
dietary adaptations do you make based on the body composition?
Oh, it has to go. We have to look very deeply into the clinical history or the dietetic history of the patient and why is he coming into our office. But yes, most of the times we have to go and Kenna was talking about the body fat, lean body mass control, and about how this pounds right here more or less will play a very important role in how am I going to take that direction to. So if it's actually asking the patient to lose a little bit of fat mass, then I would have to cut down some calories from their diet. That's what we normally do. And as Kenna said, we just can do it like, okay, I'm going to drop you down to, I don't know how many pounds, and I'm just cutting off 1,000 calories. No, you have to make you have to make slight changes through the time. And this particular area right here in the chapter for the body fat and the lean body mass control will allow us to do that. So that's like a good blueprint, but you have to look into the particular things that your patient wants. So that's like something that I like to do. Another thing is that we have to go through the exercise recommendations, because most of the times what the patient really needs is to kind of increment the lean body mass that they have. So yes, I can do wonders with nutrition, but if nutrition is not merely combined with exercise, then the lean body mass is not going to go up. So that is like a very good point.
As you mentioned that, Anna, one of the things is when I have my patients present to me, and I find that the reason most of the patients do show up in my office is because a spouse has recommended that they get the care that needs to be, because they're hurting, they're in a lot of pain. So typically what I do is I look at the person not only on the physiological side of it, on the biomechanical side of things, because that's what we do. However, we have to look at the state of their nutrition as a important part. Now, what you mentioned there is sometimes you have an individual where dietary changes may not be the thing that they control. That's why when we bring individuals, we enjoy having as much of the family involved, even the children, but usually it's a spouse who's and that is really there to support the individual in the process. So as we make these recommendations and we hand them over to our nutritionist and our health coach, being part of this is a family deal, and it helps because it's sad to try to do these things by yourself. I've been doing nutrition and weight loss my entire life, and I've learned that those who analytically look at things, who have the support of their families, you know what, it's better. However, in the event that there's not, that's what we do. And that's how you and Anna, you and Kenna also assist with the coaching process through each type of protocol. So let me ask Kenna something. You were mentioning something specifically about the visceral fat area. Now, if you can you tell me a little bit about this particular graph in terms of, I see that it goes 150 to 100 to 50, and it shows a little crosshair in there. What does that exactly mean, Kenna?
Of course. So before I go into that, I also just wanted to add on with the nutrition side of things, that with it being a whole family ordeal, we in my house love pizza. However, pizza is very high in the glycemic index, not great for you. Today is actually National Pizza Day. So what we're doing is eggplant pizza. So you can cut that eggplant and you can use that as a crust instead of using bread. That way you get more vegetables. It's still crisp up, super nice. So those are kind of the changes that we're talking about that we're making. So you don't have to miss your favorite foods. You can still eat them. Just make them more enjoyable. My kids love them. They love helping make them. If you present it as fun, it's going to be fun, and they're not going to know any different. So we also explain to you things like that when it comes to the nutrition side. So this graph that Dr. Jimenez was referring to right up here, this 100 line, right where we see, this is where we don't want our patients to go over this line. This is kind of marked as our ideal healthy individual. This patient you'll see is very, very lean. Their basal metabolic is 1838. That's pretty high. They have a very significant amount of muscle and a very low body fat mass, which is really great. And for perspective, I'm 5'5", and my basal metabolic rate is around 1300. So it varies from individual to individual, and the more that we get that lean muscle mass up, the higher we will get that basal metabolic rate up, as well as drop that visceral fat down. This patient is very healthy. There is not a lot of fat surrounding their organs, so they are at a decreased risk for disease.
You know, as you indicated that we see that one of the most important things is to see what your basal metabolic rate is. Now, that to me is a core area, because fat doesn't burn many kilocalories, so that's not going to add to this number. What will is lean body mass. So when we look at the lean body mass, specifically on number 2, when you see body fat mass, as well also its skeletal muscle mass, that's the number that is actually used to compile this basal metabolic rate. And the energy production or expenditure from the muscle is by far exceeds the fat by like 90 to 1. So it really is a very important component to determine exactly what the basal metabolic rate. So the more muscle you got, the more basal metabolic rate you have. Now, what we were talking about earlier, and I want to digress a little bit, in body mass index is measured the height versus weight. Like, for example, myself, I'm considered obese. Now, I'm not obese, but the thing is that because of my height and because of my weight, those numbers are off. And that's what Anna was discussing, to be able to delineate the fat body mass index and to be able to look at a much more detailed body composition assessment. In terms of visceral dynamics, the visceral body fat is very important to be able to assess, because we've learned through many studies that the visceral body fat is that which causes the drama. I mean, it causes atherosclerosis, it causes inflammation, it causes a deterioration of many disorders. So basically, it actually is your own hormone producing system that's not supposed to be excessive at that point. The more visceral body fat that you have, the more insulin resistant you have. So the more ability that cortisol affects us when we're under stress. So we have to start here to assess an individual in their total overall body composition. Now, I know that Kenna was going to continue to this. Go ahead and take it to, did you want to go ahead and continue that on that side, Kenna?
Yes. So one thing I also wanted to say that you were mentioning is that fat cells do produce more inflammation because they release cortisol at a higher rate. So they are just like adding more fuel to that fire. So the more that we reduce the fat, then the more that we will reduce the stress level, ultimately reducing our overall prevention in diseases.
So in terms of what we've done in the past on that, when we assess this, and I got to tell you, when you have someone who's actually exercising to a level that is new to them, I got to tell you, the inflammatory rate as well as the visceral body fat, it does change pretty drastically, very quickly in individuals. So once we start getting that to alter itself, we can actually see changes within 2 weeks in that number. So it really behooves us to be able to evaluate the changes. Now, you'll notice on the bottom of this graph here, you're going to see an area there that says body composition and history, okay? So what we want to do is we want to be able to assess the areas that the individual is going through. And not only that, but how much through the period of time that we're evaluating. So once we do this every couple of weeks, once a month, once every 3 weeks, once every 2 months, we can optimize. Now, Anna, let me ask you this. In your situation, when you're evaluating dietary changes, how often do you recommend reassessing an individual through body composition determinations?
Most of the time, to be able to see changes, it would be like from a period of 4 to 6 weeks. So that is how it actually works. And chronically, yes, in chronic conditions. So that's how I implemented in order to see some changes. But there are like sometimes people that ask me to measure them every 2 weeks because they are like really, really motivated. So it actually depends on the type of motivation that your patient has.
Realistically, when we have those patients, there are some people who are new to this and they may be comfortable with sometimes once every 6 months or so. But I got some people like my athletes, man, when they're all over this. My athletes will say, I want every 2 weeks, I want to do it. They'll go to work right away. So because they can see the the changes. When you got an athlete that has, let's say in this situation, 87.5 pounds of lean body muscle, and all of a sudden goes to 88, man, they're excited. They're excited when they drop their body fat. It's incredible what the changes are. Go ahead.
This can actually help the athletes to track their performance, because it's how they are feeling with that amount of fat, how it works with themselves in the special discipline that they are working at, and how they are performing it with that amount of skeletal muscle mass. I mean, this is an amazing tool for athletes, but as you said before, there are like some types of patients that they just don't want to know what their weight is because they are so worried about it. So you actually can have like two types of patients. So ones that they don't want to know anything about the weight that they have, and the ones that want to track like all the little changes that are going on in their body. So yeah, it all depends on the type of patient.
Kenna, we have a new section there called the phase angle. Tell me a little bit about that, and I'll elaborate as I go. Well, phase angle is actually an area of the body that, if you want to make sense of it, what we want to understand is what this is. This is a conglomeration of very sophisticated algorithm that is able to assess overall energy state between cells, the actual level of energy. I got an example for you, okay? The numbers that we're looking for in general in this population of El Paso is I'm seeing between a range of between 5 and 7. However, I have seen 9s. And when you have a high number, which is what we want a high phase angle, what we're hearing is the activity between cells. Now, let me give you an example. If we go to, let's say, a library, okay, for example, you can see that the energy state of being in a library is very sedated. It's very, very quiet. Now, let's take that same image and let's now take it to a cafeteria where you have, let's say, a high school cafeteria where in a live activity, well, that would be a high activity rate. In other words, its ability to respond to stresses and health issues is a little bit greater. So what we've been able to assess is overall cellular activity rates that can actually be quantified in a number. Now, in this particular situation, we have the whole body phase angle at about a 7.3. Now, what that means is that that's at the higher end of, let's say, the average office worker or someone who's actually works out quite a bit. Now, or someone that is young and is very able to deal with that. Now, if we have a person who is very, let's say, not ambulatory, or they're more sedentary, or they sit down and they're not very active. They go from one sitting position from at home to work sitting, and at night they sit again, and they're not as active. You're going to notice that the phase angle is going to be lower. So this gives us an indication of the activity state of the overall cellular metabolism going through the body. Metabolism is by definition the compilation of all cellular activity in the body. So it's a good marker for metabolic rate. So what we want to do is we want to use this number to be able to amplify. Now, where we've seen the changes are where we have individuals, let's say at 6.3, and they go into the world of fitness and they start working out and they start doing a little bit more cardio and they increase their minutes of activity through the week. We can immediately see that overall this number starts escalating to the 0.2, 0.3 numbers above. So we can actually really control the overall state. It also tells us that the person is very, very active at trying to work and is motivated towards their process. Or if not, we have to figure out why. And it gives us a little bit of insight as to what goes on. Let me see. I think we also have this information. Now, I want to digress here a little bit because what we're going to talk about is the use of not only this particular piece of of equipment, but we're also going to be talking about the area where we're missing. Now, when we deal with body composition, we are seeing the results of what the present patient is at. However, we want to go a little bit deeper. We want to go more in the metabolic assessment, and we want to be able to see the overall metabolism. Now, once you understand that the muscle is at the core of metabolism, we have to ask ourselves, what of the muscle is the active component, right? And where we end up is at oxygen expenditure, okay? Somehow we have to ask ourselves, well, if we calculate the oxygen expenditure, we can also be able to correlate, associate, and change the body's ability to improve its overall metabolism. So what do? We use different mechanisms. So Anna, do you have the availability of that on your system there?
Can you hold up a little bit?
It's okay.
I'm having a little bit of trouble here.
What I'm going to do is I'm going to go ahead and share my screen so I can show you a little bit about the types of equipments that we use and the dynamics of working with a metabolic process that actually can assist us. Now, in that process, as I share my screen, I'm going to go ahead and share right now. And we're going to continue to share my screen. And
I'll also add in some factors on labs when we're finished with this.
Okay, excellent. We're going to go right to the labs here. Now, can you guys see my screen there, my webpage right there? You're going to see that not only do we do laboratory assessments for body compositions, but we're also able to do other assessments that evaluate the activity in the cells. So what we use is very intricate equipment that gives us the ability to assess not only their metabolic rates, but we also can see exactly how it affects different parts of their body. Now, this is what's important, because once I am evaluating someone from a total metabolic process, we want to see how it affects the brain. We want to see what is the perfusion in the lungs. We want to see what the perfusion is in the heart. We also want to see the activity of the muscle in a form of electrical measurements that we can see, is there an output that is correlated with their oxygen debt? So what we want to be able to do is to measure these differences. Now, combined with a body composition and anthropometric measurements that it gives us, taking it from the early stage of BMI to BIAs and body total fat analysis, along with muscle expenditures to the kilocalories, we want to end up and look inside the body. Now, we want to see how does the body function, right? So that's where we go with a metabolic analysis. Now, the metabolic analysis is a little bit more elaborate. So you can take the screen at any given time on it, and you can discuss that given point. So as we do the switch over, you'll see that she's got a little presentation when she's going to discuss exactly that component of it. This gives us a real understanding of what's actually happening in the body. Go ahead, take it on.
Okay, so thank you very much. I think that this has a lot to do with our metabolic ability to process the substrates that we are actually consuming. So right now you're talking about this new piece of equipment that's called PNOE. So this is like something very novel for us, but it's actually based in a lot of studies that have been going on through a lot of years, maybe 200 years ago it was when it first started. So this is like a metabolic assessment that uses the oxygen input that we consume, and the carbon dioxide that we exhale when we are trying to either metabolize a substrate like fat, carbohydrate, and protein. And it can actually show the cardiorespiratory status of an athlete when it's performing any type of sport. So that is like something very important to have.
Now, if you don't mind, you basically, the science has been there for, as you indicated, for years, and the technology is now, however, today, now we can integrate it almost in a virtual world to give you access to what usually would take a huge research department to kind of figure out these figures. Makes sense?
Yes. It actually started with direct colorimetry and it evolved into indirect colorimetry. So with direct calorimetry, you would actually had to start, you had to be inside of a chamber to be able to fully determine the amount of energy expenditure that your patient, or in this case, a dog, which was like the first subject of this study. So that was how we just started, and we just said like, okay, this is not possible. We have to continue on with the technology. So it eventually ended up being directed into indirect calorimetry. So this is like the base of the studies that are now being like very now that we have like the technological advancements, we can use that and we can perform assessments in 10 minutes or 30 minutes if you have to make like a validation. But yes, this was actually how it started. And it started, as I told you before, in the 1800s. So, well, it was like a lot of time ago. But basically what the indirect calorimetry assessments let us know is that glucose, lipids, and proteins have like the same amount of oxygen they consume. They can actually produce the same amount or a certain amount of carbon dioxide. So that is like the same assumption that we are using now with the new technology. So this is actually what allows us to know a little bit more about the kilocalories that are produced by any gram of like a carbohydrate. Every gram of carbohydrate will produce 3.75 kilocalories. Lipids can produce 9.3 kilocalories, and proteins 4.3 kilocalories. So it was actually like a very good assessment and very good studies right now. It actually allows us to have the respiratory quotient, which is actually like the base of these new technologies. So thank you a lot, indirect calorimetry. So now we have this new technology that we can use like very fast. Earlier in the days, the indirect calorimetry were like these huge machines that were like very static, and they were actually used either in clinical environments in the hospital per se, or in athletes because they actually need it. One thing that we have to look back and really kind of go into that type of information is that most of the studies made to acquire one type of energy requirements, like, oh my God. Okay, so we have to use this because most of the times we just don't know how much energy a patient might need because they have very special conditions. So we just can use like one size fits all. Just like if I try to use like the Harris-Benedict formula, I just can use it with anyone because it was actually made 91 years ago. So it was like a lot of time before. So with this one, we can actually take an individual and measure it by the way that it should be measured. So this PNOE physiological assessment or metabolic assessment can actually tell us how much is our metabolic efficiency, can tell us a lot about our respiratory fitness because it actually takes into account the volume of oxygen that we can consume and the amount of carbon dioxide that we are producing while we are either being assessed to get the fasting metabolic rate, or even if we are being assessed to make sure how much we are expanding while we are in like doing an exercise. So that is like very specific for each patient. So
Anna, what I've seen is that many times people will come in and we do a basal metabolic rate. Their phase angle is quite low, somewhere in the areas of a 4, and that's not a good sign in terms of their cellular activity. But they complain of, let's say, brain fog. Well, even thin individuals have low, phase angles. So what we do is we can actually see in a quantitative way what their metabolic efficiency is. So this gives us a deep understanding as to what's going on. As you got that screen right there, you can see that we can determine lung health. We can also see what the breathing and cognition does, because when the brain doesn't get oxygenated, and that's what makes us all a bunch of caffeine junkies, because caffeine, what it does, it actually it constricts external in my hands vasculature and opens up central circulation, such as pumps the brain with blood, which then all of a sudden wakes you up. But that's really a kind of artificial dynamics. What we want to see is the overall functioning. We want to see, and as the picture shows there, we want to see cardio fitness. We want to see what the cardiac output is in terms of a measurable way through these methods of VO2 maxes, and a bunch of things that we're going to be discussing. Now, we can also see your mobility and on top of it, what muscle type you have. Now, that's important because, go ahead. You were going to mention something on muscle type. Go ahead.
Yes, that is actually very important, because most of the times, I was a ballet dancer, and you are like comparing yourself to these other like very good dancers, and you're like thinking, why don't I have like that amount of toned muscle, or why can't I do like this movement like real fast like she does or he does? So this is special thing right here would actually like improve a lot of things, because most of the times you're either a spinner or you are like a spinner. You can do like a lot of turns and a lot of things, like really cool things with your body, or either you're kind of like a more like mellow type of dancer. So this can actually help a lot. But in the same way, this can provide like a sense of awareness of the body. Like, okay, I don't have like this. Well, the type 1 muscle type is like the slow muscles. What we know like slow muscles is the type of muscles that allows us to run or to walk, just like to do like normal things. And the type 2 are like more like intense muscle, like fast muscles. They react a little bit faster, and they are actually used in like weightlifting or either high intensity interval training. So, or maybe it's spinning if you're a ballerina. So yes, this is actually a very good type of information to have, because that way you can personalize your exercise.
When you mention that, one of the things that we do is we deal with a lot of different types of athletes. Some are wrestlers. We have a big community in wrestling, and we want to make the edge. We want to figure out where the edge is. Now, one thing I will tell you is that just assessing a wrestler, for example, sometimes you see a big guy, right? And he's really, really huge, or he's a shorter guy versus a taller guy in the same weight class. And you're kind of worried that you're going to get
happen.
That something may happen, right? But from my own experience, usually the big guy has something that the skinnier guy doesn't have, right? And it's usually a little bit of more muscle. Well, what I've learned is that that's actually a good thing not to have, because in the situation where you got 3 rounds of 2-minute attacks, if you got a lot of muscle in your arms, you are wasting a lot of energy and caloric output as well as oxygen demand. And you'll find that a lot of the big muscle individuals do not last the rounds compared to a more lean, light individual. So what we can do is we can tailor that, similar to what happens to volleyball, a different type of muscle tone. And what I'm getting at is that each sport has a specific type of training that occurs. Yeah. So what we want to do is we want to adapt to that particular individual based on what they need, if that makes sense. Yes.
Yeah, sure. And this is so individualized, and that's exactly what you want if you're trying to succeed in something. So Yes, this is very important. Something that really stood out to me in this process was that it can actually provide a lot of information in breathing and cognition and mobility and cognition. So in breathing and cognition, sometimes like you just kind of get like, how is breathing going to improve my cognition? But it actually has a lot to do with it. Every time you're trying to breathe in, you get like certain amount of volume of oxygen. And when you're trying to get it out and you don't fully exhale like the whole amount of CO2 of carbon dioxide from your body, well, that is actually something that is equivalent to hyperventilation. So every time you hyperventilate, you're losing your cognitive capacity. So this is something actually very important, because why, if you're doing all of the exercise changes that they are telling you to do in order to improve, and then you just can't think, you just can't connect the brain with the movement. And that is like something very important when you're doing like certain type of exercise or discipline. So yes, that is like something that really stood out to me. So breathing and cognition.
From breathing and cognition, you know what? All wrestlers know how to wrestle. Okay. So all athletes know, but the equalizer is oxygen debt. You have too much oxygen debt. It can make anyone, even people like Mike Tyson or the best Olympic athlete, you run out of oxygen, you're done. You're done. However, what we can do is we can actually assess and help you improve those oxygen demands based on the activities you do. So when we can measure the changes, so to speak. Continue.
Yes, and that is something really important, because this particular piece of technology of PONE is something that you can carry with your own body. It's so mobile, and you can use it while you are training, while you're seeing like all of the differences in the oxygen volume, or either in the carbon monoxide volume that you are exhaling. So that is very important for either an athlete or a normal patient that is trying to get by with brain fog or either cognition problems. So this is a real good piece of information, which leads us to how are you going to treat this type of derangement that you are
before you go into the neurotrophics, because we got some really good stuff. We'll leave that for, I know, Kenna, you had mentioned something about us being able to assess clinically actually the state of health that the individual's at. I know you can you share your screen at this point, Kenna?
Okay. So the test that we have right here, it all comes down to energy, which is what we were talking about, and oxygen. Oxygen is carried in the cells. Our cellular functions are so important. And so one of the tests we have here, you can see, is from SpectraCell. It's called the micronutrient test. And what it does is it tells us all of these small micronutrients that we are deficient in. And if I scroll down, this is the part that I find so interesting and that helps our patients so much. It's right here, the Krebs cycle. This impacts how much ATP we're actually getting out. ATP is energy. It's what fuels the mitochondria. It's everything that we need. So by looking at these little red dots, this is the micronutrients that this patient happened to be deficient in. And instead of just saying, oh, you're deficient in zinc, we can physically show our patient everywhere that zinc would have to come into play. So for example, this patient is deficient in vitamin B1 and B3. And we can see that it impacts this first part of the Krebs cycle, as well as the second and this third. And overall, they're not getting as much cellular energy and ATP and output that they could be. So by adding in those correct supplements to their diet with either external supplementation or food supplementation, different changes we can make, we can increase their ATP and increase their output in general. So this is also going to come into play.
Kenna,
and
keep
help.
that there, right there. And what I've noticed is that when we're talking about the mitochondria, okay, we're dealing with a highly complex organelle that is in every living cell in our body, except probably red blood cells. So what happens is that when we look and we're measuring the amount of oxygen debt, we are looking as to the total mass of what the mitochondria produces. Now, having said that, what Kenna has here is a window into the processes that are actually occurring in the mitochondria. Don't expect to fly through a hurricane if you've got weak bolts put together, if you don't have the right tools, not enough oxygen, not enough certain what they call cofactors. You'll see the word called Krebs cycle for a neat name of a confusing monster of chemistry that plagues us all as we go through medical school. But one of the things is that when you understand that what we're looking at these VO2 max and using the mechanisms of respiration to determine total output of energy expenditure, we're looking at the engine. This is the engine that Kenna has here.
Yeah.
So it's important to understand what the cofactors are, what the enzymes are, and what your metabolic state is at. So it's critical that not only do we understand how the output is, but we go look inside the engine and seeing what does it have? Is it missing magnesium? Is it missing selenium, B2, glucose? What is the component that the body is deficient in? Okay, also, we can look at the oxidative state with these studies. So in essence, what we can do is we can look deep into that process. So now we have a full circle. We can go deeper if you want, because I know we also have genetic tests that determine your ability to produce activity or produce more energy states. So we can evaluate the genomics component, even go one step deeper and actually see how the chromosomes are predisposed to react to this issue. So we have a lot of information that we can actually find the problem in the individual or actually tweak for individuals who have certain genetic, let's say SNPs or single nucleic polymorphisms that make them not so optimal and help drive the right pathways as they should be, if that makes sense.
Yes. Something that I have to mention about the application of indirect colorimetry and this precise moment right here, the Krebs cycle, that we could actually translate it to metabolism. It's the fact that most of the times a lot of, the main application that was like clinical application really brought a, like indirect colorimetry really brought a lot of light into knowing what type of substrate was the patient using in a very acute setting of the injury. So in the first period of acute injury also comes with a lot of metabolic processes that are shut down, particularly this pathway right here. So if you're not using your, it was not the Krebs cycle, it was actually a little bit more of the glycolysis cycle. So, the glycolysis pathway. So when this gets shut down, because it takes a lot of ATP to do the process, most of the times the patient would have like protein energy wasting. So it actually, by using the indirect colorimetry assessment, you can provide the best amount of substrate and the best amount of energy that the patient could metabolize without going through a hassle or without maybe going through a derangement of their status. So that was actually really, really helpful. Right now, we can translate that information into a kind of more like an athletic setting. And that way we can either help a patient with an acute injury or a chronic disease the same way that we can treat a patient. So it's very, very helpful.
As we can see here, evaluating each individual is very, very personal, and that's where functional medicine can contribute and really can give us an understanding of the overall picture. Now, I know that prior to doing these particular tests, we do a detailed assessment. But let me ask you this: is there something really important right here? Because I do know that we also can find the overall oxidative state of the individual on this particular test that you wanted to show, Kenna. Well, there he is. And what we can see is that we're going to have to scroll. I don't have control of her screen, but I want to go ahead and explain that we can figure out what the overall metabolic processes are. I think she's there now. And as we look at things called the methylation cycle, and she can go past that. I think at the bottom, you'll see the oxidative states and the oxidative positions of the body as it produces. So overall, when you can stop it right there, and you can actually see a little bit of what happens when we deal with insulin and the glucose interaction. Now, what Anna was mentioning, the Krebs cycle is the more elaborate system of our body to produce energy. Now, right before that, we have what they call glycolysis, which is what they call anaerobic metabolism. It's without oxygen. Yeah. It's what gives us the first 8 reps, the gun, the first fight. But not too long after, at around the 15th to 20th rep, when cardiac output starts kicking in, the Krebs cycle is taking over. So we can actually measure that. So not only do we measure the handoff of the glucose mechanism or the glycolysis cycle, but we also enter into the area of the Krebs cycle function. So it's wise to understand where our missing component is. It's almost like you got to go dancing and you forget your shoes. That would be the same thing if we don't have magnesium. Well, it's not going to work as well, right? So what we want to do is help the individual reach the optimal state of health through a physiological understanding of what the biochemistry is. So I know you're back there, Kenna. Can you go ahead and engage? Well, she's not. She's got the other thing. So no worries. What I'm going to do is I would like to go ahead. I'm going to take over the screen here for a split second here, because what I want to do is I want to go over a little bit of the detailed assessments that are actually done in the lab findings. So I'm going to go ahead and just kind of touch base on that. So as I share my screen, we are using technology in a fun way here. So let me see where it's at. So we got it in there, and here you go. And can you see that on that screen right there?
We can see it right now. Yeah.
So what you're going to see is that certain types of exercise protocols will help us in this assessment here. So when we look at this, we want to see the overall, metabolic rate. We want to see the aerobic rate. We want to see our progression. As we show progression, we see how the person is improving. Pulmonary function and pulmonary respiration rates, breathing and cognition, as Anna indicated, we have to deal with that. But this guy right there, somewhere in what we call the cisterns, this is where the Krebs cycle lives. And not only there, but in the extracellular area or intracellular area of the actual mitochondria is where we produce energy. So when we see the pulmonary cardiac output and the oxygen expenditure, it's this machinery that determines our health. Now, all the studies are reflecting and pointing to the fact that if you have good mitochondrial health, this is how the body defends itself, not only in the immune system, but the ability to defend itself against disorders and disease. Now, we'll get into that later, but I want you to know, if you got a strong mitochondria and it's fully ready to be able to sustain, and as a general rule, you have good mitochondrial function, you're in a greater place than an individual who has a less functioning mitochondria, who is susceptible to disorders of all sorts, okay? So when we look at that kind of stuff, we want to see. Now, once we understand, we can give you what we call an overall assessment in a process where you can see where your body is healthy at. Now, here you can see a graph of an individual who would be more like me, because my cardiac output would not be as strong as my strength output, right? Because I'm more of a bodybuilder kind of guy, right? So I have a lot of muscle. I'm considered obese in the BMI, okay? So because of my height and my weight, but I have about 110 pounds of muscle, which gives me a much more of a curve in this direction. So what we want to do is we want to balance the system so we can actually be more of a fit individual. These measurements can be done on a periodic basis. And actually for different types of individuals, it does allow us to bring the health. So now we are dealing with mitochondrial health. We understand the cardiac output for the pulmonary function. We see activity rates in a way that has never been done before. We also can actually see if you're having nutraceutical deficiencies. And that's where we would rather adapt the dietary adaptations so that a nutritionist can look over those areas and improve based on the individual changes. So as you can see, we have shown many, many points here that we have to assess. So not only do we just give someone a Mediterranean diet, and there you go, okay? Or it's the way it's going to happen. No, we have to assess the changes. Now, you know what? Test. I don't believe anything. I want to see numbers change. So when we see that, we can understand, okay, you've been good, but what we want to be able to see is actually how you're feeling and actually see the results as it goes on. I hope that made sense.
Yes.
So what I'd like to do today is, Kenna, are you going to show any other components of it? Or is that pretty much it right there? Pretty good?
Yes, those are the components that I have.
Okay, so today we're going to, this quite a little time, and we have a good time doing this thing. We're going to go ahead and take an intermission. We'll come back and we'll probably be discussing nootropics in another type of seminar, which is going to add the ability to assist us in understanding what things we can do to help our brain become more active and aware. Now, a nootropic is typically like, it could be as simple as caffeine or a medicine or a stimulant or a thing.
Or
we're going to talk about, or what?
Tea.
Oh, there you go. So we can do different kind of things that can help the issue. My goal is to give you an awareness as to what a nootropic is and to bring its awareness into the neurological cognitive function of an individual who has brain fog. Okay. So we'll talk about that when we come back. So we'll see each other in a few minutes.